Hello to all you coaches out there in Activate Land. Today we are going to talk about an important topic, and that is pre-screening before beginning a physical activity program. We will begin by discussing why it is necessary to pre-screen. We will then discuss who is at greatest risk for having an adverse response to exercise, and then finish with the details of how to effectively screen your potential participants. So let's start with discussing why we should pre-screen. First, it is important to understand that the risk of having a severe adverse response to exercise, such as a heart attack or even sudden cardiac death, is really very low, especially in healthy individuals. But when we do exercise, there is a very small increase in risk of having such an event. How great of a risk? Well, research shows that for every 15,000 to 18,000 individuals who exercise per year, there is approximately one death. This represents a small risk, but one that should be taken seriously. Let's now take a look at why there is an increased risk of having a heart attack or sudden cardiac death with exercise. Here we present the main theory as explained by the American College of Sports Medicine. This is a picture of two cross-sections of two different arteries. As you can see, the artery on the left is healthier than the artery on the right, which has plaque buildup. This buildup of plaque is an occurrence that tends to increase over time and increases with the amount of risk factors for heart disease. One of the risks of having plaque buildup is that if plaque should break off in a large enough chunk, it can travel downstream, lodge in an artery, and block blood flow to the heart muscle, effectively causing a heart attack. It is theorized that with acute vigorous exercise, there is an increase in the frequency of heart contractions as well as an increased force within the arteries that causes bending and flexing of the coronary arteries. This in turn can lead to plaque breaking away and causing a blockage downstream. The goal of pre-screening is therefore to identify those at greatest risk for having such a coronary event. Now that we have all you coaches worried about your participants having heart attacks, let's step back and remember that the chances of that happening are very low, and the reason we are doing this activity is to prevent such an event from happening. But most importantly, it's critical to remember how important your work as a coach really is. When your participants exercise regularly, you are actually helping them lower the risk for heart disease. This graph at the bottom of the slide gives a nice visual as to just how important exercise is. What you are looking at is research data showing that the higher one's physical fitness is, the lower her or his risk is of having heart disease. So now let's take a peek at some of the groups who are at a higher risk of having a severe adverse response to exercise. Research has shown that those who are previously sedentary, who perform exercises they are unaccustomed to, and especially exercises at high intensities, are at greater risk. These are just some reasons to begin exercise programs at lower intensities and progress from there. Also, those that have known heart disease or metabolic disease such as diabetes are at a greater risk as well, and pre-screening tools will help you identify these individuals. So now let's talk about how to do the actual pre-screening as a coach. As a coach, you have access to a PAR-Q form. PAR-Q stands for Physical Activity Readiness Questionnaire. It is a form that can be completed by the participant and will tell the participant the next steps he or she should take. There are 7 questions. If the participant answers no to all questions, they are safe to begin exercise. If they answer yes to any question, they can talk to their doctor and get recommendations about the program they wish to participate in. The PAR-Q is a well-established tool for identifying those at risk and is nice and simple to use. As a coach, it is a good idea to print out a dozen of these forms for your first few classes to hand out to new participants to be filled out before they begin. If any participant approaches you and has answered yes to any question, feel free to suggest they wait to the next class and first consult with their physician. However, if he or she has answered yes to question 5, which asks if the individual has musculoskeletal pain with exercise, you should use your discretion as a coach. If you feel that you can modify the exercises correctly to avoid the participant feeling pain or becoming more injured, she or he may not need to discuss the program with their doctor. If you have identified a participant who should discuss the program with their doctor, tell them they can watch the class for today if they wish to, but should get a doctor's permission letter signed before they join in the next class. The individual shouldn't have to necessarily make an appointment, but should contact the doctor's staff and email or mail or fax both the PAR-Q and a doctor's permission form, which you will have access to through Activate. and have the physician fill out the form and fax it back. This form will include suggestions by the physician such as make sure the patient is hydrated and does not do any exercise that could hurt their knees. It will be important for you as a coach to help your participant follow their physician's instructions as best as possible. These tools will help keep your participants safe and are simple to use. Feel free to contact Activate at any time and we can help you with the screening process. Thank you to all you coaches for your hard work, and remember, safety first.